Do people comment on your child's behavior? Like, your child is out of control, or hey, you have a wild one on your hands, or hey, get control of your child. If you're wondering if your child has ADHD, this video is for you. First, a couple explanations. What is ADHD? ADHD is attention deficit hyperactivity disorder. A common question is, are people born with ADHD? Yes, many experts believe that ADHD is present when a child is born. At what age is ADHD typically diagnosed? By the time the child is 7 to 8 years old, it can be properly diagnosed. ADHD cannot be diagnosed any earlier because the child needs to go through proper child development stages. We may see characteristics or symptoms of ADHD, but it cannot be properly diagnosed until the child has aged up through the age of 7 or 8 years old. Challenges for children are focus demands, patience, and self-control. So here are the top 7 signs to determine if further assessment is warranted. Number 1, if your child is unable to sit in a calm environment, such as at the church sermon, the school classroom setting, or at a doctor's appointment. Number 2, constantly fidgeting. This refers to squirming in their chair, their restlessness, the pencil tapping, the leg bouncing, things of that nature. Number 3, physical movement. They are always on the go. They are running, they are climbing, they seem to appear as if a motor is powering them and they're unable to stop. That is the excessive physical movement. Number 4, this is excessive talking. This is where the child is monopolizing the conversation, not sharing with others present in the group. They may also make no sense with the conversation. They may go off topic. They may wander with their thoughts and things. It's completely disruptive. Number 5, interrupting conversations. Oh, every parent hates that, interrupting conversations. This is where the child is butting into conversations that they are not initially a part of, and they're just throwing it off, and it's very disruptive. Number 6, unable to wait their turn. This is waiting in line, playing games, anything that requires them to wait their turn. Number 7, this is acting without thinking. This refers to ready, fire, aim. It's not the proper procedure of executing whatever is intended. So whether it's using their words or playing a game, it's not the proper sequence. An example would be basketball. You have the basketball, you shoot, but you're not aiming at the basketball hoop to score the points. It's not the proper sequence of events. So this is acting without thinking. They don't fully think through the consequences of whatever they're doing. Please do not take this video as a clinical diagnosis. If you happen to observe these tendencies or behaviors intensifying or becoming more frequent, a professional diagnosis is warranted. Who can make a diagnosis? This is your pediatrician or a psychologist. The criteria for diagnosis is very specific and complex.